A Davidson County Chancery Court ruling says one program that Tennesseans rely on for vital health care services must continue.
So that is despite recent pushback from the Tennessee Department of Health. Our Marius Payton joins us now in studio with a breakdown of that new ruling.
The temporary injunction means the Department of Health cannot report identifying information about those enrolled in the Children's Special Services Program to Immigration Enforcement. Now, for context here, back on June 1st, more than 400 families that were enrolled in the Tennessee Department of Health CSS program received a letter saying that all patients getting health care who are not legally in the United States will be reported to the Tennessee Department of Safety. The program provides medical and care coordination for people with chronic physical disabilities from infancy to the age of 21. It's described as a payer of last resort, meaning the people enrolled have no other way to pay their bills than to use this program. The Tennessee Justice Center says they filed a lawsuit back on June 24th on behalf of 3 Nashville physicians who have patients enrolled in that program. Now, according to that lawsuit, the doctor's patients require ongoing care for life-threatening conditions such as congenital heart disease, leukemia, and severe seizure disorders. They say that even a brief disruption of care would be harmful, if not deadly, for some. Now, with this new ruling, the department must also restore and maintain enrollment for eligible children. That injunction is in effect until a trial happens, which hasn't been scheduled yet.